Good morning. My name is Rob Moquin, and I'm a National Service Representative with Unifor. Prior to my role here, I was a primary care paramedic for just under 20 years. Today, I'm proud to not only represent the members I have in the Thunder Bay and District area, but also the 700 Unifor paramedics working across the province, many of those in northern communities where the challenges are especially urgent. Every member of the public expects when they call 911 that help will arrive immediately. This is not necessarily the case in Northern Ontario. It has nothing to do with the amount of ambulances that are provided, but not having enough paramedics to staff them. In Northern Ontario, the staffing crisis is critical. Paramedics in the North have been witness to the devastating impact of chronic shortages caused by workplace injuries, both physical and mental. High rates of burnout due to call volumes and utilization. It is not uncommon for an EMS crew to finish their 12-hour shift and have completed that shift at over 90% utilization. Chronic understaffing places an extra burden on paramedics working in rural and remote areas. When staffing levels are down, the effects ripple through the entire region, leaving communities across the vast area without adequate coverage. There are 500 kilometers between our most western and eastern ambulance stations. The gaps of staffing shortages are felt deeply. These shortages mean paramedics are stretched too thin, overworked, and often unable to meet the response times as required by the ministry. They're forced to juggle emergencies across vast distances in communities that are isolated and often under-resourced. Northern Ontario paramedics are critical to the success of our healthcare system, yet they are burning out rapidly. Low wages, long hours, limited mental health supports are driving experienced professionals out of the field, and this is not sustainable. We need immediate action to address this crisis. We are calling for concrete solutions, improved funding, specifically tailored to the unique challenges in Northern Ontario. This funding must ensure competitive wages, incentives to attract and retain paramedics in the North. Mental health supports. Paramedics witness traumatic events regularly while working under immense pressures. Those in rural and remote areas face additional barriers due to the lack of practitioners available in these smaller communities. Assessing the mental health crisis is essential to keep paramedics in the profession. Recruitment and training. This means funding paramedic schooling across the province, supporting preceptor programs, and creating a clear pathway for more people to enter and stay in the program. These are not just challenges for paramedics, they are also challenges for everyone who live in Northern Ontario. When paramedics aren't available, lives are at risk. While the government may point to the creation of new positions, these numbers mean little if we can't fill them with qualified people. It's time for the Ford government to listen to the people on the front line and take action before this crisis deepens further. The proposed task force is a step in the right direction, a collaborative space for us to work together to address these urgent issues. Unifor is committed to working with all stakeholders to ensure that paramedics have the resources they need to deliver life-saving care to the good people of Ontario. Thank you.